Hi, my name is Ignacio Bermudez. Forensic toxicology. She studies the presence of toxic substances in human tissues, organs, and body fluids, and the role these agents may have in contributing to or causing and providing answers to questions arising during an investigation. Was a drug or poison involved in the case? What type? How was it given? In the modern era, forensic toxicology is used in the areas of analytical chemistry, pharmacology, and clinical chemistry to solve cases with medical legal consequences and where the results could end up used in court. In the 21st century, homicides are less likely to be caused by poisoning, but many people involved in death investigations have consumed drugs that have affected their behavior and/or their health. Toxicology will also shed light on whether the drugs have been consumed as recommended or have been abused, or even if the adverse combination of drugs have been prescribed. Applications: poisonings, homicide cases, traffic accidents, sexual assault/date rape, drug overdoses, interactions, and sports doping. The critical first step in a forensic investigation is visiting the crime scene and protecting it against contamination. Samples collected must have a chain of custody to protect the evidence. A forensic toxicologist may be called to be an expert witness to evaluate scientific evidence in court. Blood, to screen and confirm most common toxic substances present inside the body at the time of collection. Urine, best specimen for comprehensive drug and poisoning screening, normally used for testing employees and athletes. Vitreous humor, gastric contents. Oral ingestion is the most popular means of exposure to drugs and poisons. The toxicologist identifies and quantifies the presence of drugs and chemicals in blood and tissue samples. Accurately establishing the appropriate cause and manner of death has serious implications for public health and public safety. I will now describe the various testing methods for forensic toxicology. Immunoassays. Most commonly used drug screening tests. Immunoassays are laboratory tests that use antibodies to detect a reaction with specific substances. Immunoassays screening tests are designed to detect whether a sample is positive or negative for the targeted drug. Four interpretations of a screening drug test are possible: a true positive result, a false positive result, a true negative result, and a false negative result. For those samples that give positive screening results, confirmation tests should be performed, preferably using mass spectrometry. Chromatograph detection is an analytical procedure used for separation of compound drugs and is frequently based on either high-performance liquid chromatography or gas chromatography, coupled with MS. This is the definitive technique used in toxicology to establish proof or structure of unknown substances. Forensic science relies on lab accreditation. Laboratory accreditation is a process of an independent competent authority inspecting policies, practices, and procedures for compliance with the credible standards. It provides the public and users of the services with an objective measure of reliability of the laboratory's operations. The following definitions are important to understand. Reliability: the quality of being trustworthy or of performing constantly well. The degree to which the result of a measurement, calculation, or specification can be depended on to be accurate. Accuracy: the quality or state of being correct or precise. The degree to which the result of a measurement, calculation, or specification conforms to the correct value or standard. Validity: the quality of being logically or factually sound, soundness or cogency, the state of being legally or officially blinding or acceptable. These following images depict flowchart, testing methods, and sample collection. Potential drawbacks to forensic toxicology. It is essential that analytical systems are fully validated and fit for the purpose, and assay batches are monitored with quality controls. External proficiency programs monitor both the assay and the personnel performing the work. For a laboratory to perform optimally, it is vital that the circumstances and context of the case are known and the laboratory understands the limitations of the analytical systems used, including drug stability.